Before we discuss how to apply a transdermal patch, let's look at how the patch is put together so you will better understand how it works. The patch is made up of several layers. The outermost layer keeps the drug in the patch. The next layer is the drug reservoir that contains the main dose of the medication. The next layer is a membrane that controls the release of the drug from the reservoir. The innermost layer is adhesive and keeps the patch on the person's skin and will hold a small amount of the drug as it moves from the patch to the skin. Steps for administering the transdermal patch. Gather all of the supplies you will need: the medication, the MAR, the person receiving the medications. Wash your hands and apply a pair of clean gloves. For each person and medication, match the person and the medication to the person's name and the medication that are due on the MAR. Always use the 5 rights plus 2 each and every time you administer or supervise the self-administration of medication. Write your initials, the date, and the time on the patch using a Sharpie or other permanent marker. Locate the site where you will be applying the medication. Clean and dry the location prior to administering. Remove the old patch and cleanse the area with soap and water to remove any residual medication. It is extremely important the old patch is removed. There is still a substantial amount of the medication remaining in the patch and can cause an overdose or other adverse reactions if it remains on the person when a new patch is applied. Choose a new, dry, hairless application site. Always be sure to rotate application sites. Don't apply to a site that has rash, scratches, scrapes, or any alterations of the skin integrity. If necessary, clip the hair from the site. Do not shave the area. Shaving may cause irritation. The most commonly used sites include the upper arm, the chest, the back, behind the ear, or lower abdomen. Avoid areas that have scar tissue, calluses, bony prominences, and hairy surfaces. Clean the application site with soap and water and dry thoroughly. Open the drug package and remove the patch. Without touching the adhesive surface, remove the clear plastic backing. Apply the patch to the application site without touching the adhesive. Document the administration of the medication on the MAR. Return the medication to its proper storage location. Discarding a patch. Remember, a significant amount of the medication may still remain in the used patch. To avoid accidental exposure to the drug that could harm a child or animal, it is very important that you take precautions when discarding the patch. Fold the used patch in half with the adhesive layer inside and place it in a closed container that is not accessible to children or pets. Apply this medication as directed by the doctor. Be sure to wear gloves and avoid touching the ointment with your fingers. Carefully squeeze out the dose onto a paper dose measuring applicator. These applicators are supplied with the medication. Place the paper applicator with the ointment side down on a dry, hairless area of skin, usually on the chest. Do not rub the ointment into the skin. Using the paper, lightly spread the ointment to cover an area of a size directed by the doctor. Tape the paper applicator into place and cover with plastic wrap to avoid staining the clothes. Wash your hands after applying and removing the medication. Please write your initials, the date, and the time on the back of the applicator paper before you put the ointment on the applicator. Document the administration in the MAR.
You are caring for Joseph, a 28-year-old male with cerebral palsy. You will be taking over the medication administration from his mother. Joseph gets scopolamine patch every 3 days to assist in decreasing oral secretions. He has been using the patch for approximately a week. His mom always puts the patch behind his right ear. Is it okay just to continue placing it in the same location? Perfect! You must not only remove the old patch to prevent an overdose, but also rotate the site to prevent issues with skin integrity.